So, Mark, something that's been more important in healthcare than ever before is getting women in IT leadership. Talk to us about that.
Well, it's key. Within the industry, we're a heavy female-oriented industry. We've got lots of, traditionally nurses. I mean, we have a lot of men in it as well. But it has been, compared to other industries, we've had a lot of female involvement in professional positions. Unfortunately, in healthcare IT, we haven't had as much historically, although we've seen some excellent CIOs now in healthcare that are females, and they're doing a terrific job. So I think we have a responsibility to encourage that, and I think at Intermountain Healthcare we're making some strides to do so.
Well, explain exactly what you are doing.
So we've, and again, if you look, what we've done specifically, we've hired some very excellent female executives. Katrina Holzhauser, who works directly for me, has a pretty key role in what we're doing in IS. And then even in some of our technical ranks, we have some very senior leaders that are females. And I think it's really good for our culture, for our perspective, and we're getting some amazing talent. Another thing I didn't mention, I really appreciate the leadership of Karen DeSalvo as the new national coordinator. I guess she's been there a couple of years, but she's really a good example of how the perspective that can be brought, but there's the tremendous leadership she's bringing to our industry.
So is part of it promoting inside talent and part of it recruiting from outside women that bring a lot of strengths?
I think so. I mean, if you think of technology, historically it was so male dominated. It was all of us geeks sitting in mom's basement, knocking away on a computer.
World of Warcraft.
And I think women would have been embarrassed to be down in the basement doing those things. but since it's come out of the basement and it's become more mainstream, a lot of really talented women have become involved. So we need to look internally how we can promote, but externally for people that might be interested in Intermountain Healthcare.